Good morning. This presentation will be about older people with HIV's willingness to participate in end-of-life cure research in Canada. Approaches to develop a cure for HIV focus on latent reservoirs, which require biopsies of deep tissues. These biopsies are invasive procedures. Some could be harmful for participants and must be conducted post-mortem. Investigators who are members of the CanCure, an HIV cure research collaboratory, assembled to create an HIV autopsy biobank. And hopefully people with HIV will consent and be inspired to donate tissues and organs to this biobank. However, end-of-life cure research raises several ethical and personal issues. So in this presentation, we will explore factors affecting willingness to participate in end-of-life cure research for people with HIV who could be participants. We used a mixed method study design. We included people with HIV living in Canada over 65 years old or terminally ill. We began enrollment in the McGill University Health Center in Montreal. Because of COVID, we faced several challenges. So we expanded to the Maple Leaf Clinic in Toronto and also disseminated information about the study through community organizations coast to coast. Data collection included a quantitative survey administered online or by phone to all participants. It also included a qualitative in-depth phone or Zoom interview done with a subset of participants. The survey and the interview were about quality of life, experience of health and research, medical aid in dying, and willingness to participate in HIV cure research, in tissue donation, and also being performed a research autopsy. Data collection instruments were inspired by the Last Gift study, a study done by the University of California in San Diego, and they were adapted with the involvement of the CanCure Community Advisory Board. We reached a sample of 35 participants, mostly from Toronto and Montreal. 9 of them had terminal illness. The average age was 70 years old. They had been living with HIV for an average of almost 30 years. In terms of gender, 90% of our sample are men. And in terms of ethnicity, 90% of our sample are white or Caucasians. Our results are about their participants' willingness to participate in 3 types of end-of-life HIV cure research. First of all, there is the willingness to participate in medical research towards the end of life, their willingness to donate tissues to be stored in an HIV biobank, and their willingness to donate body for research autopsy. Most participants are willing to participate in these 3 types of research. However, as you see on the graph, willingness drops for tissue donation and research autopsies. We asked participants about their perceived risks and benefits. Few participants perceived risks. Risks that were perceived by the highest number of participants, so by over 10% of participants, had to do with side effects and feeling vulnerable. So participants were worried about, for example, unpleasant side effects and possible permanent irreversible side effects. Or in terms of vulnerability, they were worried for their health coverage, that end of life made them vulnerable, or that they could be taken advantage of. Many participants perceived benefits, especially that had to do with altruism. So over 3/4 of our sample agreed with benefits such as being able to pay back the HIV community, being able to help others, helping advance biomedical research, or contributing to research at the end of life, or feeling good. Less than 20% of participants perceived individual health benefits. So for example, hoped that they would no longer have to take their medication, or hoped that their health improve. Concerning tissue donation and biobanking, we asked participants about the features of these processes that they considered important, and over half of participants considered important features that had to do with the consent process, knowledge transfer, the simplicity of research processes, and the community involvement. For the consent process, they hoped they considered important that their permission be asked, that detailed information about the usage of tissue be given, that donors could withdraw their donations at any time, and that consent be obtained for knowledge transfer. They wanted the results to be shared with the public and the community and with donors when possible. For the simplicity of process, they wanted their donations to cost no money to the donors. And they wanted that health information be obtained directly from the medical files when possible. And for community involvement, they wanted the research to be overseen by an advisory committee. Our qualitative results came from 12 in-depth interviews that we did. Our preliminary thematic analysis allowed us to identify a few facilitators, including a good experience of participation and involvement in research in the past, interest in the research topic, an easy participation or an accessible way of participating in research, considering participation as altruism, the respect for privacy and confidentiality throughout the research process, and not having finalized one's will. In terms of barriers, we found religious beliefs or cultural preferences, the physically painful past research experiences, the difficulty relating to the research topic, unknown or self-interested research objectives, the fear of losing quality of life, long-term complications or side effects, the uneasy access to research procedures or complex procedures, and having already finalized their will. And as you see, family and loved one is right at the border. It can be a facilitator or a barrier, depending on people, depending on context. Participants describe their preferred approaches for end-of-life HIV cure research. First of all, they would like to be approached by their healthcare provider with whom they have a relationship of trust. Then investigators and community organization representatives could join the discussion. We would have to see with each person if other people should be included in the discussions, like family, friends, and partners. It depends. It should happen through face-to-face discussion, transparent discussions that would be directly about the topic. We should ask people if they have written their will and if they have preferences and concerns, and investigators should be ready to adjust the research process to these. Some participants suggested information sessions in small groups that could answer more questions and allow people to share their experiences and emotions. And these processes should start as soon as possible so we can give people time to think about it. And we could be able to meet them multiple times to discuss this. Participants had several questions for investigators about HIV cure research towards the end of life, tissue donations and biobanking, and the research autopsy. So for the research towards the end of life, people want to know, for example, why will I be left alone? What will be the side effects? As we get into the tissue donation, people wonder what will be done while I'm still living? What are the risks? Will procedures be done when I'm really near the end of life? What is the goal of all this? And as we get into the research autopsy, what is the exact time frame for each procedure? Where would this be conducted? Will I still be able to join my partner? And what will happen to me? So in conclusion, we hope to still include participants, and especially participants of greater gender and ethnic diversity. But with what we have so far, we see that people conceive HIV cure research as a form of altruism. So potential achievements of research should be put forward. Older people with HIV in Canada are willing to discuss participation in end-of-life cure research, but less participants were ready to donate tissues or donate their body to science after their death. Participants want to talk to trustful and knowledgeable interlocutors. So this reminds us of a whole set of features of consent that we shouldn't forget. For example, consent should be a continuous, accountable, and empowering process involving several discussions over time, and it should be initiated early before one has finalized their will and made decisions about their death. Thank you very much.